Hi, my name's Charles Buck, and I'm a speaker at the Evidence-Based Acupuncture Symposium to be held in Providence, Rhode Island. And in my session, I ask, why is it that our profession isn't taken more seriously? Why don't we seem to get the status that we deserve, and what can we do to change things? These are questions I've asked myself for some 35 years as a professional acupuncturist. And in the late 1970s, I moved from a career as a neuroscientist into the world of acupuncture and Chinese herbal medicine. And I wanted to feel more secure in what I was doing. I didn't want to feel like a fraud. So this led me to look into a detailed study, make a detailed study of the science of acupuncture and the science that supports Chinese medicine in general. And this is something that I used in my clinic and also for my self-assuredness as well in what I was doing. So I imagined that I would be able to communicate the value of Chinese medicine and acupuncture by indicating this research and by knowing it quite well. I'll be looking at some of the issues, for example, making research count. How do we make the research count in the modern world, in modern people's eyes? How do we persuade policymakers? How do we convincingly communicate Chinese medicine theory and its value and meaning? It's one thing to show efficacy or mechanism, but actually we also have to show that the models have some value as well. We have to look at the way, I want to look at the way that our brand is perceived, and also the difference between promoting brand acupuncture, say, with brand acupuncturist, which is a different thing. So we're going to talk about that. We want to look at the ways that clinicians and thought leaders in our profession can be more effective if we understand these dark arts of belief change and cognitive science behind PR, branding and persuasion. So I'm hoping that my session in Providence will help us have a more coherent communication of our brand and to facilitate wider acceptance of professional acupuncture and Chinese medicine in the future. So I'm also really looking forward to the meeting of minds that will happen in Providence in September. We've got some great people coming, some people who I know personally are real thought leaders and real good communicators in our profession, and who are, like me, passionate about the future that our medicine deserves in modern healthcare. So I very much look forward to seeing you in September.